Hey guys, my name is Dr. Kyle Daigle. I am a local chiropractor in Lake Charles, Louisiana, and I get a chance to travel pretty much all over the world to teach over laser therapy, mold exposure, childhood development, traumatic brain injuries. I have an active social media page that I kind of try to use to educate people. But today I want to talk about mold exposure and how, my opinion, I think this could be, part of the future of our healthcare, at least issues. So NeuroSolution, it's a group of healthcare experts and entrepreneurs that we all got together and really just tried to create a mission to try to help educate and change the world. And we're doing that through using photobiomodulation, which is actually red light therapy. Here's a medical disclaimer for the video. Just to let everyone know that this is just for informational purposes, and definitely to talking to your healthcare practitioner about this before trying anything out. I just want to educate you guys of things that I found clinically and that have made a big difference in patients' lives. But I just want to make sure that this is a medical disclaimer right here that always check with your doctor before proceeding with any type of treatment. All right, so here is my business partner, Dr. Brandon Crawford. Here is my little guy right here. His name's Kingsland. This is Dr. Crawford's child. And then some of you guys may have seen us from a really awesome, amazing guy, John Grant, and his lovely wife, Laura. And really what we've been able to do with patients is we've been able to help a lot of patients with traumatic brain injuries recover. And it's not just about the physical stimulation or the lasers or vagus nerve stimulation or primitive reflexes, but really it's encompassing everything and also looking at gut health, because the digestive system, it's where we absorb all of our nutrients, and that's what's going to feed our brain. And that's what I'm hoping to possibly educate you guys with today. Here is my lovely staff. We have a very large team. We have a clinic in Lake Charles, Louisiana. We have one in Atlanta, Georgia, and Austin, Texas, and soon to be in the Middle East. If anyone has any type of inquiries or wants to possibly, seek therapy, we do what's called intensive therapy, and you can reach out to my assistant, Jordan, at tech@uperformance.com. And then here's the number or WhatsApp to reach out to. All right, here's my family, just to give you guys a little background. This is my lovely wife, my son, Kingsley, my beautiful daughter, Blakesley. If you guys want to follow me on social media, you're more than welcome to find me on Instagram. That's typically my main source of promoting, what we do and all of our education. And then I have a QR code for you guys down here. All right, so Dr. Crawford and I and our team, we got together and we decided to come up with these three basic pillars of health. Energy, sensory, and movement, since we felt that these are very crucial. So with energy, we like to talk about nutrition, we like to talk about laser therapy, and also the frequency of treatment that's done. And then from a sensory perspective, these are activating something called cranial nerves. We do believe that the brain basically sensory input drives motor development, which means the input that comes in, the brain learns and eventually can produce an output. For example, if you want to learn a new language, you have to typically practice it. So you have to stimulate your brain, you have to practice it, and then eventually you can actually, speak a different language. The same thing goes when someone's paralyzed, is that the brain has to typically become aware of the extremity that it needs to work with. So you need to put all this input in to make the brain register, hey, this is the arm that needs to be moved. And then eventually with the right type of therapy and reducing the amount of inflammation present in the body, then, the brain has at least a higher probability of making that extremity move. And then movement in itself. I think that purposeful movement is key. I just think that you don't just take an arm and start moving around. There's definitely a hierarchy in order to try to get some movement present. So, we like to really talk about primitive reflexes and stability and the equilibrium, but exercise is definitely key. So we talk over three basic pillars of health: energy, sensory, and movement. All right, so let's talk about inflammation. So inflammation is a complex biological response that occurs in response to tissue damage, infections, or irritation. It's a normal, natural response to have. But if inflammation becomes chronic, it can lead to tissue damage, pain, dysfunctions, autoimmunity, sicknesses. So people out there listening, if someone wants to, go to the doctor and see if they have any inflammation, I put on here, there's something called C-reactive protein, ESR, a CBC, ferritin levels, something called interleukin-6, which is a cytokine that's involved in inflammation. And then even testing something called tumor necrosis factor alpha that's also involved with inflammation. So these are just some basic blood chemistry panels that you can have your clinician run. Another one of my favorite ones to run is called homocysteine. I work with a lot of children with developmental delays, ADHD, autism, dyslexia, even kids who have something called PANS or PANDAS. And I like to run homocysteine to see what their, inflammation levels look like. And because a lot of these kids have something called methylation issues, there's something called the MTHFR. It's a gene it's a gene expression that a lot of these kids typically have issues with. And within that, the way the body actually gets rid of inflammation or processes inflammation or toxins is often a little bit delayed or dysfunctional. So finding out exactly how much inflammation someone has and if there's any underlying factors can be definitely key and critical to help and assist the recovery in whatever type of, whether it's a developmental delay or even traumatic brain injuries or recovering from infections. The digestive system is extremely, extremely important, especially in brain health, or if you're trying to recover from a chronic infection or pathogens. And so, what's happening is inflammation can be stemmed from artificial flavorings, synthetic sugars, preservatives, food sensitivities, pathogens from the environment, molds, yeast, bacteria, viruses can lead to conditions such as inflammatory bowel diseases, Crohn's, ulcerative colitis. Inflammation can also cause the intestinal lining to become either damaged or thinned out, which can lead into something called intestinal permeability, or also known in a lot of alternative clinics called leaky gut. And I do believe that inflammation is a driving force for nutrient deficiencies and also many neurological symptoms. A lot of patients, for example, patients with multiple sclerosis, strokes, complex regional pain syndrome, vertigo, headaches, migraines, ADHD, traumatic brain injuries, and autism. Typically, you can see that these patients normally, if you run, stool samples, blood chemistry panels, you're going to see inflammation markers. And inflammation for a sustained period of time can cause dysfunction. So the goal is to try to figure out what potentially could be causing, inflammation or stress within the body. I clinically see that, diet modifications make a really, really big change in trying to reduce the amount of inflammation. And then you're going to see that, the environment, your air quality control, all the way down into the fabric softener or your soaps and stuff like that's placed on the skin can have an impact on someone's inflammation levels. So again, musculoskeletal issues, people who have chronic pain that, they've been to chiropractors, they've been to physical therapists, they've been to PTs, they've been to acupuncturists, they tried every type of cream known to mankind or supplement or medication, they still have pain. A lot of times there's something we call that systemic, meaning there's something probably going on in the systems. I typically find the gastrointestinal system is definitely where you can find underlying issues. And I think it's very important to really, really get into gut health. So just some basic things that someone could do to try to help out with mitigating inflammation. Omega-3s are really, really awesome. So like fish oil, turmeric, resveratrol. I'm a very big fan of a product called Cellcore. They have something called Inflamma Control. And there's an essential oil, frankincense, that works really, really awesome that can be taken topically or orally. And then another really big thing I'm a fan of is histamine support. So they have something called like Histadio, Hista-X. What this does is it basically breaks down a lot of inflammation. And so these are just some basic things that I start with patients with. All right, so we're going to get into mold and mycotoxin exposure. I had this little presentation that I just got back from Sydney, and I was teaching these doctors and therapists, even a couple of parents in there, about how powerful mold or mycotoxin exposure can be. And I do think that it's definitely an underlying factor in a lot of cases, specifically with children, on the spectrum, or even patients with traumatic brain injuries. So, I've worked with a lot of kids. I've worked with kids from all over the world. And oftentimes when I get these kids that have like really, really red cheeks, parents always make comments that, family members always talk about, how cute their red cheeks are. And, to me, when I see that, it's kind of an alarm sign that this child or this adult has a lot of histamine, which is inflammation. And when you see it in the face, it's not that good. And so the question is really what's underneath. And, when I start running laboratory panels, whether they're stool samples, urinalysis for mycotoxin, mold exposure, we see that, there's a lot of inflammation in the digestive system. These patients typically test positive for very high levels of mycotoxin or mold. And if you're breathing this stuff in and it's not actually getting eradicated, well, anyways, if you breathe it in from your nose, and, it can cultivate and go down to the gastrointestinal tract, or it can eventually even impact the brain. And so you see this a lot of times with kids. Kids, they could be good, during summertime, they're at home, they go back to school, they start getting chronically sick all the time, or, your child has to go to daycare and you start noticing your kids getting sick in daycare frequently. And maybe you want to walk in and you kind of smell a little bit, and it kind of smells a little musky in the school, in the daycare. And if your child potentially is getting sick or having behavior patterns or getting weird skin reactions, or they're kind of having neurobehavior disorders where they're getting like impulsiveness, they're getting getting aggressive, maybe it might be wise to look at potentially mold exposure. And so really, what is mold exposure? And mold basically releases things called mycotoxins. And mycotoxins are toxic substances that are produced by certain types of fungi that can grow on walls, air conditions, windowsills, washing machines, carpet, furniture, crops such as corn, peanuts, wheat, other grains. Mycotoxins can also contaminate food products when these fungi infect crops during the growing, harvesting, and storage process. And so, I see this a lot of times with children with peanut allergies, is that, a lot of times these kids actually have aflatoxin, which is actually a fungus that's present. And it's very unique that as you actually start to get the gastrointestinal tract stronger, you work on these things called primitive reflexes, and you remove the food for a sustained period of time while you clean up the gut and reduce all the inflammation. We've seen in some cases that people have been actually able to reintroduce the food whenever they get the aflatoxin out of their system down. All right, so exposure to mycotoxins can have several negative impacts. Sorry about misspelled that, on human health, including the digestive system, autoimmune issues, inflammation, neurological disorders. In terms of the digestive system, mycotoxins can cause acute and chronic effects such as vomiting, diarrhea, bloating, stomach pain. They can also lead to liver and kidney damage, suppressing the immune system, making individuals more susceptible to yeast and virus and bacteria. And so I see this a lot of times when patients, for example, they start coming to see me initially. I'm normally a fan of a low carb diet initially, because a lot of the times, clinically, I think that, most people typically have fungal issues or yeast overgrowth from excessive carbohydrate intake. So my goal is to kind of reduce the amount of carbs initially, because a carbohydrate can turn into sugar, and then sugar can actually be a source of fuel, especially for yeast. I had a patient this morning I was talking to as her first visit, and she had all these, wild range of symptoms like insulin resistance, thyroid disorders, cyst, blood sugar fluctuation issues, headaches, skin reactions. And she was craving, always constantly craving sweets. And, I was talking to her about, we're just getting started. So, I always recommend running a stool sample initially just to see if there's any underlying issues. And what I find in these patients most of the time is that they do have like a Clostridium infection, or maybe they have an overgrowth, or maybe they have mold exposure, or maybe they have other type of species such as like strep or E. coli. And I think it's very important because on a daily basis, we're constantly getting bombarded from bacteria and viruses, preservatives. And if you don't know that you have these things underneath and they go for a persistent period of time, that can start, inducing potential autoimmune issues, and that can even eventually turn into disabilities. So this is why, I'm making this video, because I teach doctors and clinicians this stuff, but I just wanted to kind of get to the public and just let you guys know what we're teaching and clinically, hopefully trying to help you at least get maybe some potential answers to what's going on. Mycotoxins, so mold exposure, can also contribute to autoimmune issues such as chronic inflammation. Some studies have also suggested that mycotoxins may trigger an autoimmune response. They can contribute to the development of conditions such as multiple sclerosis, ALS, rheumatoid arthritis, and lupus. So if you have some of these underlying or clinically diagnosed issues, the goal, what we try to teach people is to try to find underlying factors, because if you have an autoimmune disease, the goal here is to actually figure out how you can start reducing the amount of inflammation in your body, so that way you can at least make a recovery, or at least being able to tolerate the symptoms that you may be clinically exposed to. So, my personal opinion is really looking at the digestive health and the sinus health as ways to really kind of regain your health or get your health back. In addition, mycotoxins can have impact on the central nervous system and can cause neurological disorders. I've seen things clinically like tremors, involuntary movements, headaches, anxiety, depression, muscle fasciculations, which are twitching, eye twitching, calf twitching, dizziness, complex regional pain syndrome, regional sympathetic dystrophy, and even neurological disorders or neurodegenerative disorders like Alzheimer's and Parkinson's. Here's a video. It's on YouTube. Roll out infections, mycotoxin, 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 mycotoxin. Literally highlight that, underline that. I'm telling you, run those panels on these chronic pain patients. School teachers, I'm telling you, they got mold in schools. Daycares, they got mold in daycares. I've seen literally patients, all different type of religions, having mold exposure from churches. If you're a child or you have a patient, ask them where they go to school. Is this school an old school? Is this school like from the 1900s? Is it from the 1950s? Have they ever had any water damage, any tornadoes? Mold can do that. All right. So just some environmental trigger pollutants, they can impact neurological functions. So you see cognitive impairment, memory loss, difficulty concentrating, learning disabilities, neurodegenerative disorders, Alzheimer's, Parkinson's, Huntington's disease, neural development disorders such as autism, ADHD, dyslexia, headaches and migraines, epilepsy and seizures. I see a lot of seizure patients that typically have mold exposure. And as it's very interesting that when you research something called propionic acid, which is actually a byproduct from Clostridium, so basically yeast, propionic acid is actually a potent neurotoxin. And so, you typically see with seizures, ketogenic diets, basically a high fat diet is often typically clinically recommended. And again, it's in the research. But really what's happening is when you reduce your carbohydrate, your sugar intake, you can get less inflammation, or you're actually preventing the source of fuel for yeast. And if you reduce the amount of inflammation or the amount of neurotoxin from propionic acid, you could potentially reduce the amount of stress being applied to the brain. And then that can translate into the brain performing and functioning better. And that means that a lot of different type of neurological symptoms, headaches, migraine, dizziness, even potentially seizure activity could potentially reduce. I do have this really neat mold podcast. I had a patient's mom, Katie, and I just really wanted to really stress the impact that mold can have. Her and her daughter Brooke went on a long journey trying to find answers to chronic pain syndrome. And I just decided and said, hey, Katie, look, let's just get on a podcast and let's just talk about, how mold basically impacted your family's health and your daughter's health. And this is definitely an emotional podcast. And you can definitely, watch this on the internet. But the goal here was for us just to educate, people about mold exposure, because I do believe that it is potentially going to be another health epidemic that's coming. So here is just an example of this lovely, beautiful girl named Brooke who, had mold exposure, and it caused her to have some very debilitating pain. And then when we got her, she was actually even more forward than this, more flex. And then as you start seeing that, as her brain started progressing, we were actually able to get her to start standing upright. Which again, if you think about this, I tell people, if you've ever taken a CPR class, they teach you the first thing in a cervical spine injury is to elevate the chin so that way you can open the airway. And so when patients start coming in very hunched over, do you think that this patient's going to get good oxygen supply to the brain? And that answer is no. And then if we can start getting her to stand up straight, and when you go to breathe, you're going to get way more lung expansion, which is going to give you more oxygen to the brain, can be very beneficial. Hence people are getting into HBOTs and doing other types of oxygen therapy, which are very beneficial clinically. In our clinic, we really like running what's called QEGs. I see a lot of very traumatic stuff. And really the goal is just to kind of see really what's going on neurologically within the brain. So that way we can see things like hyperactivity. We can see things like in the blue here, underactivity. We can look at all the amount of inflammation or all these hyperconnected or underdeveloped or underconnected networks. And then it just kind of gives us something clinically to kind of target, whether we're, in physical stimulation on certain body parts or certain nerves to access certain parts of the brain, or whether you can trace the vascular supply to certain areas of the brain using lasers or oxygen therapy. There's even things called PMF, pulse electromagnetic frequencies, where people can actually put certain modalities over certain regions of the brain to enhance the function. Or you can even get into looking at brain waves, and then even using like music therapy with isochromic tones or binaural beats to help activate certain parts of the brain. And it's just neat because, when I run these QEGs, I'm really trying to look at something called Brodmann areas. These are specific anatomical areas, networks in the brain that actually have certain functions. And then if these different areas are weak, then you can actually see symptoms. And the cool thing about the brain is that you can do a lot of basic exercises on a consistent basis to strengthen these individual networks, just like if someone, injures their knee and they go to, physical therapy and they do all these exercises, and then those exercises strengthen the knee. You can do the same exact thing for the brain, where you can actually rehab or strengthen up or do exercises to specifically target certain networks to improve symptoms that someone may be experiencing. Okay. Really, really awesome research here. And again, I have this thing that came from real-time labs, but it's just showing you that, people that get exposed to mold, basically it can cause some autoimmunity, or can cause stuff called like histamine, where you can get inflammation. It can cause, gastrointestinal issues. It can cause nutrient deficiency issues. It can, even you see some of these kids that start refusing, become picky eaters. That can all be an impact. So where is mold hiding in your home? It can be in the outdoor shed. It can be in garages. It can be in the pool house. It can be on pool furniture, inside of vehicles. I've actually worked with lots of people that actually mold was actually in their vehicle because they work in a moldy environment. Mold spores can get on their clothes. They can get into the vehicle. You turn the air conditioner on, it can recirculate. Vehicles that were left, the window was open, and then it rained inside the car. It rains and you get water on your shoes, and you go put it on the carpet, and no one teaches you you can use a dehumidifier to basically drain the moisture out of a car. So vehicles are definitely a common place that people can also get exposed to mold. Carpet is huge. I'm really not a big fan of carpet. I think with people with autoimmune issues, carpet can definitely harvest or at least harbor a lot of pathogens, bacteria and stuff that you don't realize. People are walking in, you're vacuuming, and you breathe in a lot of the bacteria, fungus, mold, whatever, you get exposed to from walking in airports and walking all over the place, and people, walk in their house with their shoes, which shouldn't do, in my opinion. The bathrooms, a lot of people take like warm, hot showers and bath, and they don't have a dehumidifier to absorb the moisture, so that moisture can, get into the actual wood and the crown molding or crevices, and that could be a small little place that mold can grow. Air vents are very, very common things. Classrooms, crawl spaces, basements. I have seen a lot of families who've had issues with mold in their basement. Windowsills. I work with a lot of families in Europe, and I've seen a lot of little kids and even adults get sick from actually the windowsills not being tight enough, and then they have the bed right next to the windowsill, and they're just constantly getting exposed to mold exposure from literally breathing in next to the windowsill. Washing machines are a very big place. I typically tell people to try to get dehumidifiers and put dehumidifiers in washing machines, just to make sure that, you at least drain the moisture out of the washing machine, or even just make sure that you really towel off your washing machine, because this is a very, very common place that mold can potentially grow. I've seen, mold, basically patients getting sick from literally the bed sheets in their bed because they had mold in the washing machine. And then when you put it into a dryer, that heat's not going to kill the mold. And so the spores are still active, and you're going to sleep, you're breathing in mold spores while you're sleeping, which that could be an underlying issue. Bad toys in kids. Definitely, if you have little rubber toys, just make sure that you constantly rotate these things. Because I've seen kids, because again, kids will literally put stuff into their mouth, and it's not an uncommon thing to get mold exposure from actually toys. Foam insulation in houses. A lot of times people have had, a roof leak, and they weren't able to detect where the roof leaked because the foam absorbed it. And then you can have a leak here on one side because of the absorption, the runoff, you can see stuff way down the house. So again, it's just not every single person gets impacted by mold, but there is a certain population of patients out there, specifically people who have the HLB27 or MTHFR or traumatic brain injuries, that potentially their body just doesn't detoxify mold like it should, and that can be an underlying issue in preventing someone from recovering. Really awesome paper by Dr. Judy, who's a holistic psychiatrist. She just kind of really talks about how toxic mold-based illness is very prevalent and underdiagnosed, and it can manifest into lots of different psychiatric conditions such as depression, anxiety, attention, brain fog, insomnia. And then she just shows in her paper or research thing that vulnerability to mold toxicity is only present in about 25% of the population. And most of these cases have a genetic predisposition, which inhibits their body to flush the stuff out. So it's not uncommon to see, a family living in the same household and only one person gets sick. And that's why it's oftentimes challenging, where someone could potentially buy a home and one person gets sick, and then the rest of the family doesn't have any type of sickness. And that either goes from genetic predispositions, someone's current health status, also the way the vagus nerve functions, and then gastrointestinal health is pretty big. So that's why if you're listening to this, you have some, weird symptoms, maybe you have a little musty smell, or you had some roof damage, or you were hit by a tornado or hurricane, a typhoon, or you just had flooding, in your home or your workplace, and, and you're the only person getting sick, it could potentially be just because you're genetically predisposed to not being able to clear mold toxicity. There's also something out there called CIRS, chronic inflammatory response syndrome, which is an autoimmune reaction caused by poor clearance of actually getting biotoxins out. Mold toxicity, again, I just had some research papers that I was teaching this, but I was just showing how pain syndromes, movement disorders, when you see people getting twitching, tremoring, that could also potentially have an underlying factor of mold exposure. Delirium, dementia, balance coordination. I get a lot of patients in my clinic with vertigo or POTS. that typically have mold as an underlying factor. We do a lot of good, really great rehab, and we can get people stable. But then if these patients, have mold in their system, then it can slowly start coming back. And that's where it's kind of good, in my opinion, I like to kind of work on both things, so that way I know, neurologically where someone's at, and then also, is there any underlying factors? And about 90% of the time, I find that it's actually both, where there's actually underlying factors, whether it's mold, whether it's parasitic infections, whether it's yeast overgrowth, and then that can actually have a neurotoxic component, and that can actually cause these neurological symptoms, whether it's headaches, migraines, dizziness, twitching, involuntary movement, sleep disorders, depression, memory, mood, motivation. All these things can actually come from underlying factors. Just, when you build a house, it's very important to really make sure that, people are really keeping the air quality in the home, because initially, even in a brand new home, it's not uncommon that people can actually start developing, mold can start growing on. And then eventually, as that, you put sheetrock on the house or plaster on the house, you don't really see what's underneath. But just because you don't see it doesn't mean it's not there. So, or even a lot of times people think they can just cover it up. Well, mold really likes sheetrock, and it's very porous. So you can also see that from the outside, you don't see, or from the inside, you don't see anything, but this stuff can be growing your walls, and then, releasing spores that could be, getting into your nasal passages, and potentially, causing a lot of gastrointestinal issues. All right. So children with allergies, asthma, may be at a higher risk for ADHD, and I get a chance to teach a lot over hyperactivity in children. And, we find that typically clinically there's stuff called primitive reflexes, there's nutritional deficiencies, there's vestibular dysfunctions, there's gastrointestinal dysfunctions, and then you get into potential pathogens or environmental triggers. And we normally clinically see a lot of these families, or a lot of these kids typically do have mold exposure, or they have, yeast from eating a very high carbohydrate, repetitive, consistent diet. So I do think that, and this is just me clinically, just speaking from an informational standpoint, but, when I see someone sneezing, typically I'm looking at trying to, look at, ruling out mold exposure. Christmas tree. I see this a lot. I've been in practice 13 years. And I started noticing patterns, and especially starting around October to pretty much March, I would get all these patients with dizziness that would start coming in. And I have a very unique mindset and brain. And so I'm always trying to figure out like common issues. And so most of my patients that come in with dizziness around that time frame, I always ask them about their Christmas tree ornaments or their Christmas tree, where they place it. And most of my patients typically will get a Christmas tree. They'll get a real Christmas tree, put the real Christmas tree in the house. And this was a really awesome study by Dr. Derek. And what he found is that mold spores have gone up by more than a 5-fold during a 14-day period over the holidays, reaching 5,000 spores per cubic meter at the end of the festive period. So what does that mean? Well, literally, you're taking this tree and putting it inside your house, and, you have the air condition blowing, and that can actually literally, mold spores can get into the living room or whatever room someone has. And that could potentially induce seizures, that could induce headaches. People can eventually get sick, get vertigo, gastrointestinal issues. Not that I'm not telling you not to have a Christmas tree in your house. I'm just saying that you should just be aware that if you have symptoms, you got to be very cautious. And it's not just the real Christmas tree. You can also see artificial Christmas trees that are placed up, in the attic. In the attic, it's not very well got climate controlled. So it's very humid up there, and people literally can get mold actually on their any type of festive ornaments. And then they put it into the home, and then that could be an underlying issue. This is from real-time labs. And again, I kind of use multiple labs, real-time labs, Vibrant America. These are urinalysis tests that we'll do to actually check for mycotoxins. But what I want to point out here is something I see very, very common when I'm running stool samples is patients who've been shown to have ochratoxin A, which is an aspergillus mold. They've been shown in research that they may have a deficiency in Lactobacillus reuteri. And Lactobacillus reuteri has anti-inflammatory properties, which means they help prevent inflammation. They help with the immune system. They also help prevent any type of irritation to the gastrointestinal tract. I see this very, very commonly present and when I work with children on the spectrum. I run stool samples. I typically see Lactobacillus reuteri always low in these cases. And then what happens is when I run a mycotoxin panel, I'll typically see ochratoxin A, which is an aspergillus mold, typically having high levels. I also see Stachybotrys pretty present in a lot of the patients that I work with. But just like this showing you here, ochratoxin A can basically cause suppression, which is what the word inhibition means, of peripheral T and B lymphocytes. So just basically how the immune system functions. So if you have this present or you're getting exposed on a daily basis and your child's constantly getting sick, potentially that child could have mold in his classroom and he's getting exposed to mold in the classroom, and that could be weakening the amount of specific, not just this probiotic, but other probiotics. And that could be one of the reasons why your child gets sick all the time in school, or even the same thing if you're a school teacher. I've seen this all the time. Another patient again this morning, she's a school teacher, and she's talking to me about how, she's normally really good during the summertime, but just during the school year, she gets sick a lot. And she's like, well, I'm around a lot of kids all the time and they're always sick. I said, yes, or potentially you could be getting exposed to mold in your classroom. And I tell people this is that, people walking around scared of mold because, mold's been around since, probably the beginning of time. But what I think's happening is the diet of people have switched from back in the day. People ate more, fruits and vegetables and meats. And then today you kind of see an inverse relationship where people eat a lot of carbohydrates, and carbohydrates basically turn into sugar, and sugar can feed mold. You think about bread, mold will basically grow on bread, but then you look at, leave a piece of meat out, you don't typically see that meat really kind of getting a lot of mold, not as fast as you would seeing from a carbohydrate. So when I see patients who, have chronic illnesses and stuff like that, I really try to drive a low carb diet just to try to help out with reducing the amount of, the source of fuel for mold and yeast. One of my favorite papers to teach over is the role of mycotoxins in the pathobiology of autism. And they've just found that, children on the spectrum, typically, based off of this, is that they found that, they do potentially have ochratoxin A is, a mold that's been commonly present. And then when you look at research on the gut-brain axis from children on the spectrum, you often see that, they have gastrointestinal issues. So, my goal for every parent that potentially watches this video is to at least, if anything, I'm not saying this is what's causing it. I just would like to encourage you guys to just look for underlying factors, because the body is self-healing. And if you can slowly start chipping away at certain, stressors or things that cause inflammation, at least you give, any individual trying to recover from anything, at least a better shot at trying to make a more significant recovery. Eczema. It's very, 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 very common to see when I see patients with eczema. They could either see, irritations from soaps, from laundry detergent, mold exposure, excessive carbohydrate intake. All those things can have the implication of causing skin alterations. This was just a paper that was looking at moisture and mold problems in school. And they were able to see, based off of emergency visits. Okay, just to kind of give you guys a little bit of what I see clinically working with children on the spectrum. I see lots of mycotoxin exposure. I often see times issues with secretory IgA. This is part of one of the immune markers that line the intestinal barriers. A lot of your sinus barriers, gut barrier, lung barrier, you'll see secretory IgA lines that. When I see this thing elevated, normally is when I see these kids that maybe have more irritation, more behavior, more stimming episodes. So I definitely like looking at this. The next thing is zonulin. This is a marker that looks for something called intestinal permeability. This marker basically lets us know about the integrity of the gut barrier. So if you guys ever looked at leaky gut, you'll see the gut kind of looks like this instead of being like this. And zonulin is regulated by something called a neuropod cell, which is innervated by the vagus nerve. That vagus nerve comes from an area in the brain stem called the medulla. And that nerve, or that area, controls the vagus nerve. It also controls tongue movements. So find it very interesting to see that children who are nonverbal often have potentially mold exposure prevalent with, lots of gastrointestinal issues, with intestinal permeability or leaky gut. So my opinion is kind of this big vicious cycle. And then we see things like primitive reflexes. You see pupil asymmetry where their pupils, one pupil, for example, the right eye is often bigger than the left. These little things are called the nasolabial fold. You'll see typically kids have better tone on the left side and it's a little bit flatter on the right. And then maybe they have like a head tilt to the right. So what you're seeing here is there's a lot of neurological deficits that are being distributed. And you can see these things in something called cranial nerves. And the cranial nerves are what are going to gather information from the environment, how you see, how you hear, how you taste, how you smell, your spatial orientation. And if basically the environment is getting abnormal sensory stimulation, and then you have all these underlying stress response from inflammation, whether it's mold, fungus, yeast, parasitic infections, viruses, you kind of see this perpetuating vicious cycle. And this is why I think that there's such a hard time with really working with all kind of different cases, whether it's a neurobehavior case, whether it's a neurodevelopmental delay, whether it's a autoimmune case, is I think that, we really need to kind of look at the whole picture. You need to look at the brain function, the cranial nerves, primitive reflexes, organic acid panels to see someone's nutritional status, their gastrointestinal system by running gut zoomers, CBCs. And really, we kind of all need to kind of put all this together so we can kind of put together a comprehensive plan to allow people to recover. Okay, so I was doing a research. I was doing a talk over immunology and basically developmental delayed children. And I came across this article, which was very fascinating. It was published in 2013, but it showed that there was aflatoxin M1 in breast milk of UAE. So basically in the Middle East, which is in the desert, they were actually finding literally aflatoxin M1 in breast milk. And I found that very, very interesting that, the mom could potentially be passing a pathogen down to the child as early as literally day one. And if you think about a child's diet, as initially they're being fed typically breast milk or, formula, and then they kind of go into a little bit more of a high carbohydrate diet. They start eating all these like cereals and crackers and breads, but those things turn eventually into sugar. And, I just started questioning, why do these kids have, colic? Why do they have inner ear infections? Why do they have eczema? Why do these kids have random involuntary movements? Why do these kids have developmental delays? And, I'm just a very curious person. And this is what kind of dove me into doing a lot of this research. And, I kind of just put it together from what, I clinically see in my practice, because most of my patients, when they come see me, they've been to about 30 to 50 different doctors. So it's, my job that I have to think a little bit differently so that way, I can at least help this person out, because most of the time they've tried, most of all the normal things. And when I look at it from a comprehensive standpoint, I find all these dysfunctions, and oftentimes it's very overwhelming. So trying to put this together to be able to help answer a mom to, where did we get to this place in the first place? And, just a slide like this or this research paper is just very intriguing to see that, even an infant could potentially be getting exposed from literally day one. This little thing right here, so propionic acid induces gliosis and neuroinflammation. So I've seen a lot of patients with multiple sclerosis, even having lesions in their brain. And, for me, what I want to do is figure out what potentially is going on in the sinus cavities or the sinus issues, which I do work with a lot of phenomenal ENTs, and they love me because of I've been able to, refer patients to them to be able to help out with their sinus issues. Even dentists, I've been able to see, work with dentists. I actually have I have an orthodontist that was coming to see me, and he asked me, he says, "Hey, Kyle, do you have an idea of why I'm seeing all these kids with cavities in the upper mandible?" And I was like, "Well, have you ruled out mycotoxin exposure?" And he's like, "Well, what's that?" And I'm like, "Well, mold exposure." He said, "I didn't even think about that." And I'm like, "Yeah, I'm telling you, look, when you look at MRIs or CT scans, you'll see mucosal thickening in the frontal and maxillary sinuses. And, that could potentially be, mold exposure that's actually calcifying within the sinus cavity. And that can have an implication to creating a stress response on the cranial nerves that innervate the teeth that then go to the brainstem. And then you can see that these kids could potentially not have as strong as teeth. And that could potentially allow for cavities to actually start, eating away at the teeth, inducing, issues. And then that can cause a whole nother problem as well. Really, again, just the paper to show you guys, but just showing, mom exposure to wheat, bread, cheeses, juices, dried fruit. And then whatever the mom's eating is actually going to feed the baby. So it's very, very important, in my opinion, that someone who's pregnant, they really watch what they're eating. And I'm a very big fan of, in pregnancy, to really kind of go on Paleolithic diets to try to really kind of not eat so many carbs, so that a way you potentially can reduce the amount of mold exposure that a mom has, and that way it doesn't get brought to the baby. Because again, if the mom potentially has a mold exposure and she goes to breastfeed the child, then she could potentially pass mycotoxins to the child. And then that could potentially start developmental delays at a very early age. Okay, so propionic acid, it's a short chain fatty acid that's produced by yeast in the gut during fermentation of dietary fiber. High concentrations of propionic acid has been shown to have neurotoxic effects. It may contribute to neurological conditions such as autism. The other thing is that it's been shown that it could lead to inflammation and damage to the intestinal lining, that allowing propionic acid to leak into the bloodstream and impact the brain, which is not good. I see this a lot of times when I get these kids that are like banging their heads, or they're constantly hitting their head. Normally I find these kids either have some sort of yeast or mold present in their body. And as that level typically lowers, then you see the self-inflicting behavior patterns start to reduce. Same thing goes from research has shown that high levels of propionic acid can cause behavior changes. This was actually done in research on animal studies. And they found that, the higher the level in the animals, the more agitated, the more anxiety, the more stereotype movements and social deficits they had. Clostridium species produce propionic acid as a byproduct. So think about all these children on the spectrum who are eating breads, crackers, pizzas, cereals, cheeses. All of those things they're highly carbohydrate rich. Those things turn into sugar, and sugar basically feeds mold and feeds yeast. If it's, yeast, you can release propionic acid. Propionic acid becomes a neurotoxin, and then you see this kind of vicious cycle. Here's a example of one of my children that I had, who had a very significant horizontal nystagmus. Her eyes were going just side to side and had seizure activity. But I want you to look at this. Now, again, I'm very big into collaborative. So I'm working with a dentist who, did this awesome scan. But you're going to see mild mucosal thickening found in the floors of the right and left maxillary sinuses. And then you're going to see right down here, mild basically inflammation in the sinuses as well. So where did all this come from? Well, look at all the mold exposure that this young little child had. So we were actually able to reduce the seizure activity, and also helping out with the stability of the eyes by reducing the amount of mold exposure. Really, we just got this little girl on a ketogenic diet, We started working on primitive reflexes. We started doing something called trigeminal nerve stimulation. We started working on improving our core stability. We started working on our balance and coordination. We taught her how to do vagus nerve exercises. And that was just kind of an overview of how we were able to help this little girl to recover. I am a big fan of nasal sprays. I've used things clinically, personally, even myself, because I got sick a couple of years ago from mold exposure. X-Lear, Rescue, or just the X-Lear, Argentin 23. These are really, really awesome sprays that we've used to try to help out with reducing the amount of basically irritants in the actual sinus cavity. So with sinus issues, what I teach, all the doctors and clinicians that kind of train underneath us is to roll out retained primitive reflexes, the rooting reflex, the palmar reflex, the ATNR, Moro. Diet modifications. I really like low carb diets, AIP, autoimmune protocol, Paleolithic diets, ketogenic diets. I'm a very big fan of the Nemechek protocol, ruling out food sensitivities, mold exposure, gut pathogens, and I also recommend air purifiers for the home and the work. We actually use lasers, but one of the suggestions that we typically teach our doctors to do, or clinicians, is actually lasering the sinuses. Also lasering the digestive system, so laser in the gut, and then also even lasering the carotid arteries to help get blood flow to the frontal lobes. And then again, there's protective eyewear that's worn for this. BPC 157, I do like peptides, but just, putting this up here because I was just teaching these doctors about this. It's basically amino acid. So amino acids, proteins are basically the backbone of the immune system. And inside of proteins, you get something called amino acids. And these things can help out with reducing inflammation, supporting the brain, liver, kidney function, nerve regeneration. But, BPC 157 is a really awesome product that we typically use. This was just a slide for me because I did actually go through my own personal mold exposure, which was horrible. So I do know that people that are out there suffering, I can clinically say that I went through this, and it was definitely not a very fun 2 years of my life. But fortunately, being able to beat mold exposure, even living in Southwest Louisiana, which there's mold like everywhere. So I'm basically trying to, eliminate mold out of my system where I'm constantly being exposed on a daily basis. And I was still actually able to beat this. It actually took me 16 full months to make a full recovery. Some people can make it faster. I have methylation issues. I had a lot of stuff that, I travel all over the world. So I'm in and out of hotels, hospitals, schools, old universities. And I've kind of developed or I can really now kind of walk into a building and within about 5 seconds, I can tell if there's mold exposure in there because I start getting symptoms, whether it's sneezing. I've even had muscle twitching, throat can get a little irritated. My eyes start getting a little irritated. So, I'm still, I still on a daily basis make sure that I eat a low carb diet and I work on myself, but I'm, now a year and a half, almost 2 years out and still testing mycotoxin exposure myself. And I'm still in the clear, even though, I've been exposed, and I work a lot in Europe, teaching over there. And, I'm in a lot of really, really old buildings. Some things that, people can do at home, diffusing essential oils are really awesome. Thyme, clove, cinnamon, dill, oregano. There's a lot of research out there that you can research yourself, but these are some things that we've used, even within our clinic, we diffuse in essential oils. Cellcore is a phenomenal product. I am a massive fan of Cellcore, from a personal perspective. This definitely is what I use to help with my recovery. And again, I just teach doctors, at least educate them about this. I have no affiliation with Cellcore. Besides that, I do love their product because it did help me out significantly, in my patients. Brain tumors, brain tumors are never fun to see, but, here's just an example of a patient who had a significant brain tumor in his left frontal lobe. And when we, got to the point to where doctors were like, there's nothing we can do clinically for you. And so he just wanted to know what was going on. So we found all of these molds that were present from a stool sample. We found, look at this. These are These are all the abnormal gut species that are present. These were all of the probiotics that this patient was deficient in. And then he even had other potential infections that were there. Here's, seizure activity. I see this a lot. Here is just, just an example of lapse from a seizure patient. And again, Stachybotrys, I actually had an engineer that was working at a refinery, and they had a lot of water damage, and he never had seizures before, and then he takes his job and starts having random onset of seizures. And once we were actually able to get this guy out of the environment initially and got his gut and stuff a little bit better, sort of working on helping his body detoxify a little bit better. This guy's seizure activity was able to reduce, which was awesome for this guy because his quality of life improved. So there's something called binders. These are things that help grab toxins and get it out of the body. So some of my favorite binders that I teach over, the cell core biotoxin binder, metabolic code has something called mycobind, and then GI detox. Preferably I like using biotoxin binder the best. But again, I've seen patients respond differently on each one of these, but I typically kind of lean more towards cell core. Dave Asprey's. I'm a massive fan of Dave Asprey's. I'm into biohacking. I've read every one of Dave Asprey's book. He's got a really cool product called Home Biotic, because, we take probiotics for ourselves, but what about our home? And he had a really great concept about trying to actually help, your home have its own good bacterial system. Testing at home, there's something called ERMI testing. I definitely, recommend seeking out professional help, but if you're just trying to, get a quick and see if maybe there's something going on in your home or your workplace, or even your child's school, ERMI testing might be something to look into. People who do have mold exposure in their homes, there is something called fogging. Microbalancehealthproducts.com has really great products that you can use to help fog areas. And then just some basic things that you can do: control humidity levels. Mold thrives in damp and humid environments, so it's important to keep indoor humidity levels below 50 to 60%, or keep them at least 50%. This can be achieved by using air conditions, dehumidifiers, proper ventilation in the kitchen, bathrooms. Fix leaks promptly. If you get a leak, don't wait on it. Try to get that thing fixed as soon as possible. Cleaning your air vac system or HVAC system. I'm also a big fan of actually getting better air vents, especially getting more of an allergy filter. Mold bomb, some pretty potent stuff, but I have definitely seen some petri dishes of what this stuff does, and this thing definitely works. But mold bomb actually is a really good fogger that can be used to help out with reducing mold spores. Definitely make sure if someone ever did use this stuff, that you take protective PPE measurements and really read up about how to use this stuff before you just start using products. And with detoxification, I tell people to think about an airplane, and you really want to kind of start slow. You don't just start trying to just detoxify, because that's how people can end up really sick. And that's what I teach my doctors, is just make sure that you really watch what you're doing. You make sure that the gut barriers are stable. You're working on vagus nerve and primitive reflexes. But at least, if anything, is to just know that potentially there could be mold exposure, yeast, gastrointestinal issues, and if that's present, make sure that you find someone who knows what they're doing to help you out.